This is a study from the French myeloma group by Thierry Facon, in which 447 patients ages 65 to 75 years deemed ineligible for an autologous stem cell transplant because of their age were randomized to receive melphalan prednisone thalidomide 400 milligrams daily for 12 months, or to receive melphalan and prednisone in the same dose and same schedule as the MP and the MPT. And then thirdly, a third regimen consisting of VAD followed by stem cell collection, and then a melphalan dosage of 100 milligrams per meter squared, which is 1/2 the usual dose for autologous stem cell transplant. And then after the patient had recovered from the first transplant, they were given a second autologous stem cell transplant with the same dosage of 100 milligrams per meter squared. And this is an important teaching point. When this study was reported back about 11 or 12 years ago by the Italian myeloma group, the results were very, very impressive. And people were talking about, gee, isn't this great? These patients, this can be given to quite elderly patients, well-tolerated regimen, and the results were very, very impressive. However, it was a phase 2 study, and as you know, you need to subject that great phase 2 study to a comparison with another regimen. And here, let's look and see what happened when it was compared in this particular study. We see the progression-free survival with the MPT at 28 months compared to 18 months for melphalan prednisone alone, but only 19 months for the VAD melphalan 100. The overall survival, 52 months for the MPT, which is quite impressive. Melphalan and prednisone, 33 months, which is about what one would expect. And the VAD melphalan 100 at 38 months. Not nearly as good as one would have expected from the initial report a dozen years ago, again pointing out to us that we must look at these regimens in a prospective randomized study, and that's why we need patients to be on clinical trials. Another option for the non-transplant patient is bortezomib and melphalan and prednisone. I won't go into the details. Or in this study, the patients were randomized to that regimen, bortezomib, melphalan, prednisone, or to melphalan and prednisone in the same dose and schedule. And we find the complete response rate of 30% in the melphalan prednisone Velcade compared to 4% with the melphalan prednisone alone. Partial response or better, 71% versus 35%, and also a greater duration of response with the MPV compared with the melphalan prednisone. Here are the side effects of neutropenia, thrombocytopenia, and anemia, fairly common, but they are certainly very manageable. Fatigue and asthenia were troublesome, but that too is tolerable. But the major problem was the peripheral sensory neuropathy, and even though there were only 14% with grade 3 to 4, there were between 35 and 40% who had grade 2 or worse. And if you're a patient with grade 2 peripheral neuropathy, you're very, very uncomfortable. it's not a pleasant side effect.